Therapy for oral infections. Included in this video are: what is oral infection? What causes oral infection? How therapy for oral infection works? Benefits and risks of oral infection therapy. How to prevent oral infections. What is oral infection?
Oral infections are infections that occur in or around the mouth.
What causes oral infection? Bacteria and viruses usually cause oral infections. They can affect the teeth, gums, palate, tongue, lips, and inside of the cheeks. Simple oral infections are limited to the mouth and are different from oral lesions, which are not infectious and may be a sign of an illness that involves other parts of the body. Oral infections can be divided into several types: caries, periodontal disease, localized dental infections, and systemic infections. Oral infections often follow similar pathways from beginning to end. Stage 1. The organisms initially responsible for a dental infection are primarily gram-positive cocci. Stage 2. A mixed infection including both gram-positive and gram-negative anaerobic organisms. Stage 3. Over time, the proportion of organisms increases until it consists of predominantly anaerobic flora. What is therapy for oral infections? It is the use of substances that act against or destroy oral infections. Indications. Therapeutic indications. Patient. The best defense against a pathogen is host response. When the defense is lacking, the need for anti-infective agents is more pressing. Infection. An acute, severe, rapidly spreading infection should generally be treated with anti-infective agents. Prophylactic indications. One clear-cut use of antibiotics for prophylaxis before a dental procedure, such as a history of infective endocarditis, presence of a heart valve prosthesis, and congenital heart disease. How oral therapy works. Antiseptics. Mouth rinses can control the excess growth of bacteria. The goal is to prevent them from causing disease. These rinses contain alcohol, chlorhexidine, povidone iodine, and 0.1% sodium hypochlorite. Antibiotics. Several antibiotics have been used to treat aggressive oral disease. They include penicillins, tetracyclines HCl, doxycycline, metronidazole, ciprofloxacin, and clindamycin. Resistance develops when antibiotics are used too much or when people don't take them exactly as instructed. Most forms of gingivitis and periodontitis can be treated without antibiotics. Therefore, dentists avoid using them unless absolutely necessary. How it's done. It's important to help keep your oral infection under control. You will need to make regular visits to your dentist. This can include evaluation of your brushing and flossing, a periodontal examination, cleaning and polishing of your teeth, and x-rays every few years. What are the benefits and risks of oral infection therapy? Benefits. If it is initiated before surgery, it can shorten the period of infection and minimize association risk. Risk. Allergic reactions, superinfection, drug interactions, GI complaints, and pregnancy considerations. Principles of management. Confirm the diagnosis. Check medical considerations. Ensure adequate hydration. Prescribe medication for pain relief and prevention of secondary infection. Oral viral infections include primary herpetic gingivostomatitis and herpes labialis caused by herpes simplex virus type 1. How can people prevent oral infections? You can prevent by hand washing, avoiding people who are sick, visiting a dentist regularly, brushing and flossing daily, and not using tobacco products. I hope you learned something from our video.
Created using Powtoon.